Imagine going to bed like you do every single night, feeling normal, maybe a little tired from the day, expecting to wake up in the morning, check your phone, drink your tea or coffee, and start another routine day. But then morning comes, and someone doesn't wake up. No warning, no noise, no struggle, just silence. It happens more often than people think. A man went to sleep after doing something he had done hundreds of times before. It felt harmless. In fact, millions of people do it every single night without even thinking twice. But that night, something went terribly wrong. While he slept, his heart rhythm changed. His blood pressure spiked, oxygen levels dropped, and before anyone could help him, his heart stopped. Doctors later explained that what he did before sleeping significantly increased his risk of a heart attack and stroke during the night. Today I want to talk about something extremely important, something that many people ignore because it feels normal, routine, even relaxing. But science and medical research show that this habit can quietly damage your heart, your brain, and your blood vessels over time. And the most frightening part? Many people only realize the danger when it's already too late. So please watch this carefully until the end, because what I'm about to share might help protect you, your parents, your spouse, or someone you love. Let's start with a simple question. What is the most dangerous time for the heart? Many cardiologists will tell you that the night and early morning hours are actually when the risk of heart attacks and strokes becomes higher. During sleep, your body goes through important changes. Blood pressure fluctuates, heart rhythm shifts, hormones regulate themselves. Your body is supposed to relax and recover. But certain nighttime habits can completely disrupt this process. One of the most dangerous things people do before bed is eating heavy meals late at night. This might sound harmless, but late night eating forces your body to stay in a state of active digestion when it should be resting. Your stomach works harder, your metabolism becomes confused, and your blood sugar levels spike. When you eat a heavy meal late at night, especially food high in fat, sugar, or salt, your body struggles to process it while you sleep. Blood pressure can rise, heart rate increases, and blood becomes thicker due to metabolic stress. For people with hidden heart problems, this can be extremely dangerous. During sleep, digestion slows down and blood flow changes. If your blood pressure spikes at the same time, it increases the strain on your heart and arteries. This can trigger heart attacks or strokes during the night. But late night eating is not the only problem. Another dangerous habit that many people do before bed is excessive screen use. Scrolling endlessly on phones, watching bright screens, or staying on social media for hours may seem harmless. But screens emit blue light that interferes with melatonin, the hormone that controls sleep. When melatonin is suppressed, your body struggles to enter deep, restorative sleep. Instead of fully resting, your nervous system stays partially active. Stress hormones remain elevated. Your heart rate variability becomes unstable. Over time, this increases inflammation, raises blood pressure, and disrupts the body's natural repair processes. People who sleep poorly for long periods have a significantly higher risk of heart disease and stroke. Now let's talk about something even more serious. Many people go to bed extremely stressed. Maybe they're thinking about work problems, financial worries, family conflicts, or the pressure of everyday life. They lie in bed replaying conversations, imagining worst-case scenarios, or feeling anxious about tomorrow. This mental stress may not seem like a physical health issue, but it absolutely is. When your brain is stressed, your body releases cortisol and adrenaline. These hormones increase heart rate and blood pressure. Your blood vessels tighten. Your heart works harder. If someone goes to sleep with high levels of stress hormones circulating in their body, the heart remains under pressure even during sleep. This constant strain can trigger abnormal heart rhythms, especially in people who already have underlying cardiovascular problems. Sometimes the result is a sudden cardiac event during the night. There's another habit that is particularly dangerous: alcohol before bed. Many people think alcohol helps them sleep. They drink in the evening believing it relaxes the body. But what actually happens inside the body is very different. Alcohol disrupts normal sleep cycles, especially REM sleep. It also causes dehydration and can increase heart rate during the night. In some individuals, alcohol can trigger irregular heart rhythms, including a condition known as atrial fibrillation. This irregular heartbeat dramatically increases the risk of stroke. So while someone may fall asleep faster after drinking, the quality of sleep becomes much worse, and the stress on the heart becomes much higher. Another factor that doctors often warn about is untreated sleep apnea. Sleep apnea is a condition where breathing repeatedly stops and starts during sleep. Many people have it without realizing it. Loud snoring, gasping during sleep, or extreme daytime fatigue can be signs. When breathing stops, oxygen levels in the blood drop. The brain immediately sends an emergency signal to wake the body slightly so breathing can resume. This can happen dozens or even hundreds of times per night. Each time it happens, blood pressure surges and the heart is forced to work harder. Over time, this repeated stress can lead to serious cardiovascular problems. Sleep apnea is strongly linked to heart attacks, strokes, high blood pressure, and even sudden death during sleep. Now here's something most people don't think about: dehydration before bed. When the body is dehydrated, blood becomes thicker and circulation becomes less efficient. Thicker blood increases the risk of clot formation. Blood clots are one of the leading causes of strokes and heart attacks. If someone goes to sleep dehydrated, especially after alcohol, heavy food, or a long, stressful day, the risk becomes even higher. And finally, there is something very simple but extremely important: ignoring warning signs. Sometimes the body tries to warn us: chest discomfort, unusual fatigue, shortness of breath, heart palpitations, dizziness. Many people ignore these symptoms, thinking they will go away after sleep. But in some cases, these signs are the body's early signal that something serious is happening. Going to sleep without addressing these symptoms can sometimes lead to tragedy. Now I want you to understand something very important. The goal here is not to scare you. The goal is awareness. The human body is incredibly resilient, and the heart works tirelessly every second of your life. But it also depends on the choices we make every day. Simple habits can either protect the heart or quietly damage it over time. So what should you do instead? Try to finish heavy meals at least 3 hours before bedtime. Reduce screen time before sleep and allow your brain to wind down naturally. Create a calm bedtime routine that relaxes the mind. Limit or avoid alcohol before sleeping. Stay hydrated throughout the day. If you snore loudly or feel exhausted during the day, consider talking to a doctor about sleep apnea. And most importantly, listen to your body. If something feels wrong, don't ignore it. Your health is far more important than waiting until tomorrow. Every night when we close our eyes, our body begins an incredible process of repair and recovery. The heart slows down, the brain clears toxins, cells regenerate. Sleep is one of the most powerful healing tools the body has, but only if we allow the body to do its job properly. Small changes in your nighttime habits can significantly reduce your risk of heart disease and stroke. And sometimes, those small changes can save a life, maybe even your own. If you found this information helpful, share this video with someone you care about. You never know who might need to hear it today. Take care of your heart, because it's working for you every second of your life. Now there is another detail that most people almost never think about, even though it happens every single night of their lives. It's something so ordinary that it feels impossible to believe it could affect your heart. But doctors and sleep researchers have been paying more attention to it in recent years, because it turns out that the way you position your body while sleeping can have a real impact on circulation, blood flow, breathing, and the stress placed on your heart. Think about it for a moment. The human body spends roughly 1/3 of life sleeping. That means thousands and thousands of hours lying in the same position for long periods of time. During those hours, gravity, blood pressure, and organ positioning all interact with each other. Your heart continues pumping blood through miles of blood vessels, while your body is horizontal, relaxed, and relatively still. But depending on how you sleep, that process can become easier for the heart, or harder. Some sleeping positions allow blood to circulate more efficiently, helping oxygen reach the brain and organs smoothly. Other positions can compress certain blood vessels, restrict breathing, or place subtle strain on the cardiovascular system. And the strange thing is that most people never question the way they sleep. They simply lie down however they feel comfortable, without realizing that over time, certain habits can quietly influence their health. Let's start with one of the most common sleeping positions in the world, sleeping flat on the back. At first glance, this position seems neutral and balanced. The body is aligned, the spine can remain straight, and there is no pressure on the chest from lying face down. For many people, sleeping on the back feels natural and comfortable. However, for some individuals, especially those who snore heavily or have breathing problems, this position can actually worsen airflow during sleep. When you lie flat on your back, gravity pulls the tongue and soft tissues of the throat slightly backward. This can narrow the airway, making it more difficult for air to move freely through the throat. If the airway becomes partially blocked, breathing becomes more strained. The body may begin to snore as air struggles to pass through the restricted passage. For people with sleep apnea, this effect can become even more serious. Sleep apnea causes repeated interruptions in breathing during the night. When someone sleeps on their back, these interruptions can happen more frequently and last longer. Each time breathing pauses, oxygen levels in the blood drop. The brain senses the drop and sends an urgent signal to wake the body slightly so breathing can resume. This repeated cycle can happen dozens or even hundreds of times during a single night. Every time it happens, the heart rate increases, blood pressure spikes, and the body experiences a sudden stress response. Imagine your heart being forced to speed up and slow down repeatedly throughout the night. Over months and years, this constant stress can contribute to high blood pressure, irregular heart rhythms, and increased strain on the cardiovascular system. That is why many sleep specialists recommend that people with sleep apnea avoid sleeping on their backs whenever possible. Now let's talk about another position that many people naturally fall into during sleep: lying on the stomach. For some individuals, this position feels comforting because it reduces snoring and may keep the airway more open. But sleeping on the stomach can create other issues related to circulation and body alignment. When a person sleeps face down, the chest is pressed against the mattress. This pressure can slightly restrict the natural expansion of the rib cage during breathing. Your lungs need space to expand fully with each breath. If the chest is compressed, breathing may become shallower without the person even realizing it. Shallow breathing means less oxygen entering the bloodstream. The heart may need to work a little harder to circulate oxygen throughout the body. At the same time, stomach sleeping often forces the neck into a twisted position for long periods of time. The head must turn to one side so the person can breathe. This twisting can place stress on the neck muscles and the arteries that travel through the neck to supply blood to the brain. Although the body is resilient and usually adapts, maintaining this posture night after night may contribute to muscle strain, nerve pressure, and subtle circulation changes. But perhaps the most interesting position when it comes to heart health is side sleeping. Sleeping on the side is extremely common. Many people naturally curl slightly or rest in a side position without even thinking about it. However, there is an important difference between sleeping on the right side and sleeping on the left side. Inside the chest cavity, the heart sits slightly toward the left side of the body. This means the surrounding organs and blood vessels interact differently depending on which side a person sleeps on. Some cardiologists believe that sleeping on the left side can place slightly more pressure on the heart because gravity shifts internal organs in that direction. For individuals with certain heart conditions, this pressure can sometimes create discomfort or make them more aware of their heartbeat. In fact, some patients with heart disease report feeling their heartbeat more strongly when lying on the left side. This sensation can feel unsettling, even though it does not always indicate a dangerous problem. Because of this, some doctors recommend that certain heart patients sleep on their right side instead. Sleeping on the right side may reduce pressure on the heart and allow it to pump blood more comfortably, especially for people with weakened heart function. However, the situation is not identical for everyone. For some people, especially those with acid reflux or digestive issues, sleeping on the left side can actually provide benefits. This position may help keep stomach acid from flowing back into the esophagus during sleep. By reducing acid reflux, the body experiences less irritation and inflammation during the night. This illustrates how complex the human body really is. A position that helps one part of the body might create challenges for another. Another factor to consider is how sleeping position affects blood circulation in the arms and legs. When someone sleeps in a position that compresses a limb for a long time, blood flow through that area can temporarily decrease. This is why people sometimes wake up with a numb arm or tingling hand. The nerves and blood vessels were simply under pressure for too long. While occasional numbness is usually harmless, repeated compression of blood vessels night after night can influence circulation patterns. People who curl tightly into a fetal position may unknowingly restrict blood flow in certain areas of the body. If the knees are pulled very close to the chest, the posture may compress abdominal organs and blood vessels. Over time, poor sleeping posture can contribute to muscle tension, stiffness, and circulation challenges. Now let's talk about another aspect that many people overlook: the role of pillows and head elevation. The position of the head relative to the heart can influence blood flow to the brain. If the head is positioned too low or too high, it may slightly affect how blood circulates through the neck and brain during sleep. For example, using too many pillows can force the neck into an unnatural angle. This may place pressure on the carotid arteries, which carry oxygen-rich blood from the heart to the brain. On the other hand, having the head slightly elevated can sometimes improve breathing and reduce pressure on the chest. This is why some doctors recommend elevating the head of the bed for people with certain breathing or heart conditions. Heart failure patients, for instance, often find it easier to breathe when their upper body is slightly elevated during sleep. When lying completely flat, fluid in the body can redistribute toward the chest, making breathing more difficult. Elevating the head and chest slightly allows gravity to help move fluid away from the lungs. This simple adjustment can reduce nighttime breathing discomfort and help the heart work more efficiently. Another interesting point is how sleeping position affects circulation in the legs. When someone remains in a single position for many hours, blood flow in the lower limbs can slow slightly due to reduced muscle activity. Normally, when we walk or move, the muscles in our legs help push blood back toward the heart. This is often called the muscle pump effect. But during sleep, the body remains still for long periods, and circulation relies mainly on the heart and blood vessels. If someone sleeps with legs tightly crossed or curled under the body, it may slow circulation even further. For most healthy individuals, this is not dangerous. But for people who already have circulation issues, such as poor vascular health, diabetes, or blood clot risk, maintaining healthy blood flow during sleep becomes more important. Another situation where sleeping position matters is during pregnancy. As the baby grows, the uterus becomes larger and heavier. When a pregnant woman lies flat on her back during the later months of pregnancy, the weight of the uterus can press against a large vein called the inferior vena cava. This vein carries blood from the lower body back to the heart. If the vein becomes compressed, blood flow back to the heart can decrease temporarily. This may cause dizziness, discomfort, or reduced circulation. For this reason, many doctors recommend that pregnant women sleep on their sides, especially the left side, to promote better blood flow to both the mother and the baby. This example shows how body positioning can directly affect circulation and cardiovascular function. Now think about something else. During sleep, the body goes through several stages, including deep sleep and REM sleep. In these stages, muscles relax significantly, including muscles that support the airway and posture. If someone sleeps in a position that narrows the airway or compresses the chest, these natural muscle relaxations can amplify the effect. That means the sleeping position becomes even more important as the body enters deeper sleep stages. Age also plays a role. As people grow older, the elasticity of blood vessels changes. Muscles become less flexible and joint stiffness increases. An uncomfortable sleeping position that a young person might tolerate easily could become more problematic for someone older. Poor sleeping posture can lead to chronic pain, poor circulation, and disrupted sleep quality. And when sleep quality declines, heart health often suffers as well. Chronic poor sleep has been linked to increased risk of high blood pressure, heart disease, and stroke. All of this shows how something as simple as sleeping position can quietly influence many different systems in the body. It affects breathing. It affects blood flow. It affects muscle relaxation. It affects pressure on organs and blood vessels. And because sleep happens every night, even small effects can accumulate over years. Many people assume that only diet, exercise, and genetics determine heart health. But lifestyle habits extend far beyond what happens during the day. Nighttime behaviors, sleep quality, and body positioning all interact with the cardiovascular system in ways that scientists are still studying. Some sleep researchers even use special monitoring equipment to observe how heart rate, oxygen levels, and breathing patterns change when people shift positions during sleep. These studies have shown that certain positions can significantly reduce breathing interruptions, improve oxygen saturation, and stabilize heart rhythms in susceptible individuals. This is why sleep specialists often encourage people to experiment with different sleeping positions if they experience frequent snoring, breathing disturbances, or nighttime discomfort. Sometimes simply switching from back sleeping to side sleeping can dramatically improve airflow and reduce strain on the heart. Of course, comfort still matters. The best sleeping position is one that supports the natural alignment of the body while allowing easy breathing and good circulation. Using supportive pillows, a comfortable mattress, and maintaining relaxed posture can all help the body remain in a healthier position during sleep. Small adjustments like placing a pillow between the knees when sleeping on the side can help keep the hips aligned and reduce pressure on the lower back. Supporting the neck with a properly sized pillow can help keep the airway open and reduce strain on blood vessels in the neck. Even the firmness of the mattress can influence how evenly body weight is distributed, which affects circulation in pressure points like shoulders and hips. These details might seem minor, but over the course of thousands of nights, they become part of the body's long-term experience of rest and recovery. The heart continues its quiet work through every moment of sleep, pumping blood to every organ, every cell, every corner of the body. When sleep position allows the body to relax fully and maintain smooth circulation, the heart can perform this task with less effort and greater efficiency. But when breathing is restricted, vessels are compressed, or posture is strained, the heart may need to work harder to maintain balance inside the body. That is why paying attention to something as simple as how we sleep can be another small but meaningful step toward protecting long-term cardiovascular health.